about our research in Pasadena before introducing our main speaker, Dr. Shu. And I'm a tall, handsome Scotsman who works in Pasadena at Huntington Medical Research Institute. It's a 66, it gets bigger every year, 66-year-old not-for-profit medical research institute in Pasadena. And it's very small. There's 50 people working there. About half are scientists, the others are staff of different qualities, usually smarter than we are. And I've got an aging study and a migraine study. Those are my two passions. This is all we do. I'm a neurologist, and it's 100% research. And so we've recruited, I'd love to recruit all of you from here if you'd like to join us. We've recruited several hundred people over the last, I can't believe I'm saying this, 19 years that I've been here. And in the aging study, and about 50 in our migraine study, which I'm not talking about today. So in our aging study, what's the goal? And Joe and Tricia, friends of ours, neighbors of ours in La Cañada, had asked me to clarify something for this meeting, which was, you know, what's Alzheimer's, what's dementia, what's cognitive impairment, and it's a good question, but it's actually really hard to answer and clarify that. But they asked me and their friends, so I have to try and do my bit. Dementia, then you may well know this. Dementia means losing your mind. And it can be caused by, you know, Scotland, people take a lot of the national drink, and that's what happens. But there's many causes, but dementia is losing your mind, and you can certainly lose it from alcohol. Alzheimer's is the most common form of dementia, and I won't intrude on the topic that Helena is probably going to discuss in much more articulate and eloquent terms, but it's the most common disorder, pathology for Alzheimer's, for dementia. And it's often mixed. There's a lot of other things. What happens as we age, when we're young, and if you're a doc and you have someone with a problem, there's usually one explanation, one disease that's causing it. When we're older, there's a whole slew of things that are going on in our bodies, right? We're from 20 years of age, we're declining. It's a downhill battle from there. Anyway, so dementia is, I hope I've clarified, dementia is losing your mind. Alzheimer's is the most common cause, and cognitive impairment is just what the word says, it's when you're impaired. Mild cognitive impairment, MCI, is a classification that we use, and I won't go into the terminology for you that we use, but it's a stage that can either go on to dementia, which is most commonly Alzheimer's disease, or it can get better. People can have MCI and they can get better. So it's a transitional stage, but there's problems. There are cognitive challenges that are not normal at that stage. It's interesting that it can reverse. I may have even muddied the waters a bit by saying this, but Joe and Tricia Joe wanted me to talk about this. And so we're studying aging. You may not know this, we don't know the cause of any brain disease. Did you know that?
Yes, I did.
And so how can you treat something if you don't know what's gone wrong? So that our fundamental research is to try and figure out what's going on. I'm not sure if I'll manage this in my lifetime, but the most beautiful girl in the world, my granddaughter, needs better knowledge of Alzheimer's before she gets to my age. And so our goal is we bring in people, we'd love to recruit you. The Alzheimer's Los Angeles do have my information, and they're going to send it out to all of you who registered. So you'll have my email. You can just contact us for consideration if you want to participate in our studies. There's no financial cost, it's just time to come into our studies. And we're really good. We do a lot of clinical, neuropsych, EEG, MRI, body fluid, molecular studies. We think we've found a marker in the urine of early Alzheimer's. Wouldn't that be nice? You have a whiz test every year. That's our goal, and we're submitting a paper on the data for that. Yes, a question.
Do you provide transportation for the studies?
Yes, we do, so long as it's not from Scotland or somewhere far away. And yeah, so we've also got a promising brainwave test with a simple helmet with EEG, no wet electrodes, a dry electrode system, where you do simple things on the computer and you get the same result as the guy who's normal. But if you've got bad amyloid chemistry going on, we can see the brain's having to work harder to get the same result. So a really cool notion of having an early challenge test, just like the cardiologists do with the treadmill, right? They put you on a treadmill and see if your heart's, your coronary arteries are struggling. And we look at what we believe is the basis for Alzheimer's disease, which is very slow, unrepaired or poorly repaired membranes in the nerve cells in our brain that we think probably starts when we're very young. And I won't go into what that means, we don't know. But our nerve cells never divide again. When you're an infant, there's a few stem cells, but the majority of our nerve cells are what we got as an infant, and we just lose them over time. And they have to remodel and repair, and maybe the errors damage the membranes and lead to the consequences of Alzheimer's disease. And I've got 1 minute left, so I see that. No, that's okay. I was just going to wrap up. So we have a hypothesis that I could bore you with at length, where we have a mechanism that we think may underlie Alzheimer's. I don't know how to treat it if we're correct, but we first have to find out what's gone wrong. And so that's our goal, and we're very, very fortunate to work locally with the Alzheimer's Los Angeles group. I'm new to this group, but also some other local colleagues, one of whom is I call her the goddess in Alzheimer's and dementia research, Helena Shu, that I'm going to introduce. She's amazing. So she's chair of the department